Perrin White, welcome to Limitless Live.
Thank you for having me.
Of course. I'm so glad you're here because you are a wealth of knowledge and you truly just... More people need to know what you do and what you know and how it integrates with the whole body. I love how you're very holistic and your approach to care with people and humans. And so, Perrin is a speech-language pathologist by trade.
Yes.
And a certified orofacial myologist, which we're going to learn exactly what that is. So don't worry. So Perrin, I want you to introduce yourself and tell our listeners and people watching a little bit about your professional background and kind of how you got into doing what you're doing now.
Awesome. Well, my name is Perrin White. I'm so happy to be here. Thank you for having me.
Of course.
Also, I'm so excited to be able to share what I do because I think it's really confusing, and rightly so. It took me a long time to even be able to say oral facial myology.
Yeah.
And furthermore, understand what it means. So, like you said, by trade, I am a speech-language pathologist, and I've been a treating certified speech-language pathologist since 2011.
Yeah.
And my early background was in language, lots of articulation, language development, lots of pediatric clinics. And prior to that, I honestly didn't really understand the mouth. I didn't really understand swallowing. And what I know now is because I was coming from a place of dysfunction. So before I even knew the words or had heard the words oral facial myology, I just knew I don't do with the mouth. I don't do those things.
Right.
And slowly over time, and with lots of little nudges being my dad, who's a retired dentist, had told me about myofunctional therapy, but, I pushed that aside. Slow nudges being I had always had poor sleep and was diagnosed with idiopathic hypersomnia, which means idiopathic. They don't know why it occurs. I was so tired. I also was most likely to fall asleep during graduation as my high school superlative.
Oh, my goodness.
Also diagnosed with ADHD in college and given Adderall and all sorts of things that now that I know what to look for, it all adds up. And I mean, let's talk about chronic ear infections as a child. Couldn't swallow pills, slept hot. All these things that you just think are one-offs or allergies, all the things. But understanding that these slow little nudges were really helpful in formulating and creating, I would say, like the fire, the ignition to understand this matters. And what I would say is from 2011 when I started practicing to when I, the years, I'm not sure, but I was age 34 when I'd finally taken my first myofunctional therapy course.
Right.
I thought it was hokey, and it wasn't actually true because I couldn't do it. But if you're not functional, then of course you don't understand these things. And when I finally was diagnosed with chronic strep as an adult, and I went to the ENT, and my tonsils were so large, like, yep, we got to take out your tonsils. We need to reduce your turbinates. We need to fix your deviated septum. I had known enough to know that I think there's something here that I'm not getting. So I said yes. And once I was able to fully breathe through my nose, my mom says, I started crying in the office, and she's right. I was, because I'd lived almost 3.5 decades not breathing properly.
Yeah.
And that was one of the big tipping points that allowed me to think, what else have I gotten wrong? And so I really looked back at what I was learning in myofunctional therapy and that certification process and realized, oh my gosh, of course I don't like the mouth. Of course I can't swallow. Of course I can't keep my tongue fully sealed up to my palate. Of course I mouth breathe. Of course I have all these, I had all the nasal issues because of my tongue, and it's because I have a tongue tie. I had upper lip tie. I had buccal ties. So I got those taken care of. And then I went and took my certification course again for myofunctional therapy. I really love twos. This will be a constant theme.
Love that.
So the second time I took it, I really got it, and I was able to get my certification in oral facial myology. And I'll go into detail a little bit, like what all that entails. But then we get into 2020. Yeah, so 2020 and
COVID year.
Yeah. So not only am I treating as a myofunctional therapist, but I'm also just a human having a really hard experience. And I ended up getting my yoga teacher training. I just knew I needed this. I didn't know why I needed it. I just knew I needed it. And it was through that training that I just started seeing these Venn diagrams everywhere, because we're talking about the breath and the prana, and this whole life force. And it just was so obvious to me, like, okay, so speech pathology calls it voice. It calls it like, vocal training. It calls it like, anything with the larynx or vocal fold dysfunction. In myofunctional therapy, we're talking about like the tongue, we're talking about the airway. And then in yoga, we're talking about prana. And it started really coming together. There's like a scientific side, but there's also a spiritual side. And they're very much interlinked together. And then after my yoga teacher training, I just really deep dove into the area of breath. And so I ended up getting some breath coaching certifications that just further helped me bolster all these skills that I have. So what I currently am doing as a combination of both my lived, I like to say my personal and professional experience, is using my foundation of speech-language pathology with the added layer, the niche of oral-facial myology. And then I get to add in yoga and breath coaching. So I'm able to treat anyone within the South Carolina area as your speech-language pathologist. Everyone outside of South Carolina, I can be your breath coach. And I'm still utilizing very similar tools. I just don't use diagnostic codes. And in fact, I get to help you advocate for your needs versus telling you what's specifically wrong. And then I get to help you find the people that you need in your area. And then coming back to what exactly is oral-facial myology. So oral-facial, we're talking about the muscles, the mouth and face, and then myofunctional is functional muscles. So oral-facial, myofunctional, and it's called myo for short. And really we're dealing with any of the muscles that are involved with breathing, speaking, or swallowing. So really think from the neck up. Anything that impacts those functions, we are going to be looking at them. And specifically, I love being a myofunctional therapist from the speech pathology side because I have so much more knowledge on language development, articulation, phonological processes, really getting into the speaking component of it. And so you can also be a dental hygienist or within the dental profession and also be a myofunctional therapist. But I personally am love the speech side because that's me. So it's in 2022. So 22, I finally put all these things together and created Breathe Well, Be Well. And I've been operating for the past 3 years, really honing this craft of bringing both the science and spirit of breathing and being and utilizing both very much scientific protocols as well as mindfulness and breathwork and meditation to really deep dive into like what's the anatomy, what's the physiology, what's the emotional charge behind these things that you're experiencing that are impacting your quality of life.
Yeah, that's amazing. Was 222 22?
All those twos.
All those twos. That was intentional.
Oh my gosh, absolutely. And
Yeah.
when I think back on it, I said I took the myofunctional, the oral-facial myofunctional accreditation course twice, and there's been some other courses that really I had to take them twice for it to sink in because I've got to feel it in my body for my own understanding to be able to then teach it with integrity and authenticity. So I like to say that I'm patient zero, client zero, because my whole rule of thumb of like, do I need to take this continuing education? Do I need to add this to my offerings? And mostly, do I want to do it? Does my younger self need it? Or would it be something that helps me now? Because I'm still unlearning old patterns that have been ingrained for the past 3.5 decades. And patterns I'm talking about mouth breathing when I get tired. So I work really hard to only nasal breathe when I'm running. And I work really hard to also get deeper, slower breathing, like when you're having family Christmas dinner or, political discussions. Like, don't go back to that breath holding. Don't go back to that shallow upper chest breathing. And then also be present, be mindful, get grounded. And all those things are what I'm teaching. And I try to weave them in with each client in a way that feels authentic to them. Yeah. Because ultimately it's about using the language that client can connect to, because it's not about me, it's about them. Mm-hmm. And then utilizing different skill sets based on what their needs are.
Right. I think that is phenomenal, being able to coordinate like both sides of the spectrum. Like we're humans, so we have a lot to our bodies, right? And being able to have that approach, I think, is huge. And also your personal experience, right? Like having walked through a lot of the treatments and a lot of the things that you are
Girl,
helping people,
all of it.
literally, like that you are helping people with every day. So I think from even a client perspective, being able to trust somebody who's walked that road themselves is huge, because then you have that personal experience, but also professional expertise to be able to help some of those things. So
It's a yes and yes, both and
yes,
situation.
exactly. So you mentioned mouth breathing.
Mm-hmm.
And a lot of people are mouth breathers, and we just do it all the time and don't even give it a thought.
Yeah.
Yet we're walking around with chronic fatigue. We're not sleeping well. We're not, we can't breathe through our nose at all. Like, why?
Why? Yeah.
Why is that? And why is mouth breathing not optimal functionally for kind of our whole system?
I think the best way to start this, because this is a big pizza. We're going to take it one pepperoni, one slice, one bite at a time.
Love it.
I brought some diagrams, and I'd love to talk about what is a proper functional breath first.
Perfect.
And then where things can kind of deteriorate, and then how you end up mouth breathing and what that causes. So I want to make sure that we understand correct oral rest posture. So when I say correct oral rest posture or correct tongue rest posture, it's not that you're like resting your muscles. It's just you're not using them actively for speaking, drinking, swallowing. So speaking, drinking, swallowing, eating, all those things, that's when you're actively using the muscles. Like right now, I am actively using my tongue, my lips, my jaw, my vocal folds, all of it. But when I'm not, like when I'm watching TV, and furthermore, when I'm sleeping, that's where it's resting. So we want the tongue tip. So this lovely diagram over here, we want the tip of the tongue behind your two front teeth, where you say na 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 na, and think of that as like you're anchoring your home base. Once you get that, then I want to see if you can slowly get the medial part, the mid blade, I call it the meat of the tongue, and even farther back, to lightly, gently seal up to the palate. Now, something I think is really, really cool is that the muscles of the tongue, there's actually 8 of them. So it's not 1, it's not 2, it's 8. And specifically like underneath the jaw, that is your tongue. So anyone that's like, oh, I have like this like gobble neck, well, your tongue muscles are low. You probably have a low tongue posture.
Yeah.
That also lets me know you probably have an impaired airway. So if we look at it from a real estate point of view, we want the tongue fully sealed up to the palate.
Yeah.
And what that does is creates intraoral pressure, so that when you're breathing through your nose and into your lungs, there's the correct balance of pressure, so that you don't have any collapse and you don't have like air getting stuck in here. So tongue is fully sealed up to the palate. What that does is then opens up the airway and allows that clear passageway for the air to go in through the nose, behind the tongue, and then into the throat. This is super important, because when you go to sleep and you lay on your back, if you're unable to maintain that correct tongue rest posture, that's where you get upper airway resistance. That's where you get sleep apnea. That's where you get impaired, basically just a deficient airway. And then also, depending if your tonsils are too big, or adenoids if you're younger, anything like that is going to decrease the amount of real estate you have for that air to flow, and you're going to open your mouth if your tongue is blocking it, because your body will not let you die. It's never going to let you die. And what I think is really cool is there's always signs. So now that we know correct oral rest posture, teeth are not touching. Oh, that's a big one. Teeth are not touching. They're about 1 millimeter or 2 apart. So really, I love to talk about, let's get the body grounded in the mouth from the tongue making contact to the palate, not from the teeth grinding together.
Yeah, like holding.
So yes.
Yeah.
Yes. So like clenching or grinding. So that is correct oral rest posture. Now that we know that, I want you to think about 3 rules. And one is, you are not broken. So if you're not doing this, it's not that you're broken. Your body's just doing the best that you can. Rule number 2, your body talks to you all the time. So these are all the symptoms that we'll get into. And then rule number 3 is, either through this conversation or working with me, or like really diving into just what airway health is, I want you to start learning the language of your body through the language of your breath. So 1, we are not broken. Ideally, I'd love for your tongue to be fully sealed up to your palate all the time when you're not eating, talking, drinking. But if not, we're going to go into rule number 2. What are these signs and symptoms? So what happens? We want the tongue fully sealed up to the palate, because the nose, basically, this is your best kept best kept secret weapon to stay healthy. So this is where we warm the air. This is where we filtrate the air. This is also where we get proper gas exchange and get nasal nitric oxide.
Yes.
So we talk about vasodilators and vasoconstrictors. We want that nitric oxide to be able to open up the blood vessels, and basically it's just chef's kiss, like the gas that you want in your body. Also, it slows everything down. So think about when you're running on a treadmill and you are gassed out, you are probably, the breathing rate is very, very high. So if you want to slow things down, you've got to go slower. You need proper resistance. So not blockage, but proper resistance. And that happens in the nose because it's basically like a conch shell up in there, and it's going all in and up and then down into the airway. But it's basically making sure you don't get this cold air straight to the lungs. So it's warming it. It takes out like the environmental toxins or just the ways the body naturally filtrates the air. So it creates better air for us. And it also does this really cool gas exchange and creating nasal nitric oxide. Now that's like from the gas exchange part. Now let's talk about the structures of the face. So the tongue, we want the full blade, front, middle, back, fully sealed up to the palate. Think of it like a foot filling the sole of a shoe. We want that because that's going to create the stability and the development of the upper jaw. So we need consistent light pressure for 6 hours to get teeth movement. So wherever your tongue is resting during the night is going to influence the shape of your face or the stability of your orofacial structures. And this guy, so if we take the skull, and I made a little Play-Doh tongue.
Love
so
that.
we want it to fully, to fully fit up there.
Yeah.
And this is your natural palate expander. This is how you get a wide palate. Lots of times as adults, going to like that rule number 2, the signs and symptoms, they'll get scalloping, or like my tongue doesn't fit, or it feels like it's too big, or, you know, it just is like tight, or I can't elevate it. Well, these are all signs something's off. It means you can do something about it. But as a kid, you really want to make sure that your tongue is up there, because children in the young developmental stages, basically their body, their bones are like Play-Doh. Now you and I are like
rigid.
We are the hard Play-Doh tongue that I have. But young kids, I mean, you can see crazy changes in their development and their facial structures. And the upper maxilla is a big deal. Like big jaw energy. You really want to make
jaw energy. I love that.
I just made that up, girl.
It's
All
like
right.
big uterus energy.
Okay.
Big jaw energy.
Big upper jaw energy. So what I love about this is the skull. Actually, my dad gave it to me. It's not my dad's. I think
I'm glad you clarified that.
It's not him. I texted him this morning. I was like, did you tell me that you stole this from the dental school when you were?
Oh, goodness.
I know. But anyway, he would use this all the time. And what I love is you can look at the septum. So the septum literally is perpendicular to the palate. So if your palate is not wide enough, and if it's starting to get narrow and arch, which a lot of people have very high and narrow arches, which is why a lot of people have deviated septums. So if the floor of the nose, which is the roof of the mouth, is not stable, that's where you get that asymmetry and the deviation of the septum. I mean, the septum alone is already broken a little bit. It's just a teeny little cartilage.
Sure.
And it is very delicate. So think of it like this delicate balance between the two chambers of the nose. Literally, if your palate is impaired, or if it's narrow or is high, that is a pretty clear sign that there's going to be asymmetry. There's going to probably be some deviation. It's going to make it even harder to nasal breathe because there's less real estate. There's less space. So
wider palate is better.
Yes.
Versus a narrow, high palate.
And let me clarify. It's not better. You're just going to have more altered breathing to accommodate the reduced real estate in your face, specifically your airway, because you're not broken. And I really want to hit home the language. Like, it's not good or bad. It's not sick or well. It's really how functional are you with what you have. And this is something that's changed significantly as I've matured in my professional career as a practitioner. It's like, as soon as you tell someone they're broken, as soon as you tell someone something's wrong, as soon as you tell them there's this diagnosis, they could immediately go into like shock or meltdown mode, or feeling unable to overcome, because it's a lot. Like, I get people that come in, I'm like, oh, this is going to take years. And I don't know if they're able to do it. And they might not. I mean, it took me years after my first myofunctional therapy course to be like, oh, okay. Okay. And what I think is really important is what can we do with what you have where you are now? And that's where the breath work and the meditation is beyond valuable. So what I would say is ideally, we would like to get as wide a palate as possible and like wide and forward. That's the growth we want because your airway is behind your throat. So we want it wide and forward versus down and long.
Yeah.
Because that also then usually ends up coming with forward head posture because what's the body trying to do? It's trying to open up the airway.
Yep.
It's trying to create more space. So this is where like body movement, breathing movement, flexibility, ability to like elevate the tongue to get more real estate behind the throat, all those things come in. So going back to your original question about mouth breathing, now that we know why tongue rest posture, correct tongue rest posture, proper tongue rest posture is so important. And this is really during the day that we're talking about. Like you've got to train and get these patterns and habits solidified daytime when you're conscious if you want to have a chance of it carrying over into nighttime when you're unconscious.
Sure.
And on your back too. So you've got gravity. Yeah, gravity. What normally happens is, let's say you have a tongue tie, which is when the tissue underneath your tongue, connecting the base of the tongue blade to the floor of the mouth, is too tight, too short, or too far forward. Essentially, I love it when you have a sleeve. It's really helpful.
Yes.
So let's say this is your tongue, and this is the floor of your mouth. And everyone has a frenulum. And actually, everyone has 7 frenulums. There's the upper lip, lower lip, 4 on the cheeks or the buccals, and 1 under the tongue. So let's say the tissue underneath your tongue connecting the base of your tongue blade to the floor of your mouth is, we'll go right here. We'll go too far forward. So it's going to be really hard to elevate here versus back here. Sure. We're thinking range of motion.
Right.
So that's if it's really far forward. Well, what if it's really long? Then you can get a little bit more movement. But if it's really short, you get less movement. And then over time, if your tongue is low, then you're not going to have that proper stability to elevate your tongue up and widen your palate. You're also going to get crowding of your teeth, which is going to then impact your nose, which is going to impact the shape of your eyes, which is going to impact your posture. So it's all related. And then what else I think is really interesting is when we get into swallowing patterns. So one of the functional things that I'm checking for is, how do you swallow? So swallowing matters because it shows me what your tongue can do. And that basically we're like running marathons all the time. So we're talking, we're eating constantly. And if our tongue and if our mouth and if our jaws and if our lips don't have adequate stability, structure, and support, then they're going to just do the best job they can to get the job done. So with swallowing, we want the full tongue blade to elevate up to the palate and back. But what I see with tongue tie or just reduced range of motion or low tone or even just like unaware of what a proper swallowing pattern is. So going back to the sleeve analogy, instead of being able to go up and back, it goes down and forward. So I might not be able to elevate, but I can push forward. So when you swallow, actually here, we'll just do it now. Yeah. Swallow. And think, what did my tongue touch? If it touches your teeth at all, that is a tongue thrust. Ideally, we want it back up to that spot where you say, na, 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 na. I talk about the spot a lot.
Na, 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 na.
So try it again. Get a little spit or take a sip of water. And when you swallow, can you glue your tongue tip to spot and then elevate the blade and swallow back?
I have a challenging time.
Yeah.
Yes.
And it makes sense.
Yeah.
Because we don't talk about this.
Right.
And also, I think the other really interesting part about the tongue is it takes such interoception because it's not like I can take my tongue out and show it to you, which I was really glad that I thought about, like, oh, this is a visual medium. I need to bring some things that I can visually show you. And that's why for me, I personally had to like live all these things for it to finally click. Sure. And it's just given me more tools to explain it. But you better believe all 3 of these things I use pretty much with every client at some point. And mostly it just helps because I want you to be able to see it, to hear it, to feel it, to touch it, and then repeat,
Right.
repeat, because it takes so many different modalities for it to become ingrained in you versus someone else and another client.
Right. And you said the spot, going back to that,
yes.
the spot is not on the teeth.
No,
the spot is like right behind the teeth.
It's actually called the incisive papilla.
Yes.
And it's where you say your ta, da, na, la.
Yeah.
Lots of times I'll see la between the teeth, and phonetically it sounds fine, but it just lets me know your tongue has a hard time elevating up to the spot, the incisive papilla, the alveolar ridge. But essentially, if you take your tongue and you touch your 2 upper front teeth and then slide all the way back right when you get to the hard palate, that's it.
Yep.
And I want that to be glued in your mind. Like when I'm not eating, talking, or drinking, this is where the tip of my tongue rests. And that's where we start. Once that gets really solid and starts to feel more comfortable, then we see how much more of your tongue can you easily elevate up to your palate at rest. And so what I think is really cool is I'm going to take lots of active exercises to help you get there, but then we're going to see, can you maintain it and keep it? And this is where it gets really fun with the breath work. So I call it functional breath work, and it's really incorporating myofunctional therapy into breath work practices. And I always incorporate nose, tongue, diaphragm exercises. So that triage, trio,
triad, triage. Who knows?
That trio of like nasal breathing.
Yeah.
Tongue rest posture, diaphragmatic engagement, that is the crux of what I call functional breath work. So once you get your tongue in the right place, great. Now we got more work to do. We're going to learn how to unblock your nose. We're going to learn how to open up some of these nasal passages. I'll use lots of like lymphatic drainage. We'll use some osteopathic maneuvers. I also use intraoral massage, and I teach you how to hold your tongue, how to pull your tongue, how to like do some cheek stretches, and also some TMJ holds, release some of those trigger points. It's
and the pterygoids and all the muscles.
All the stuff. Like it's the stuff that I call them the sneaky signs, like the sneaky signs and symptoms. I also refer to posterior tongue ties, so like not ones that are to the tip, because usually that's identified pretty quickly. It's pretty obvious. But what about the farther posterior ones? Like, what are all these sneaky signs that you really got to know what you're looking at as a collective, as a whole, as the whole story of this person, to understand they are all connected? And what I'm talking about is, I'll just take my profile, for example, because I'm the most familiar with it. As a child, I had allergies. As a child, I always was mouth breathing. As a child, I was always sleepy. As a child, I always slept hot. I don't think I was able to breastfeed very well, but I think my mom like pushed through it, which, sorry, Mom. And then what I would say is, let's see, I couldn't swallow pills, like kind of getting into more like middle school, and then high school had that most likely to fall asleep during graduation, but I was getting plenty of sleep. I was an athlete. I played soccer. I was active. I got adequate nutrition. Always falling asleep in class. Like that is a huge, huge red flag. Yeah. And then I'd say like from orthodontist. So I had braces in high school. Maybe it was middle school. Anyway, like middle school. And then I had to have them again as an adult because they had shifted. And then as an adult, I even had permanent retainers placed on the upper front teeth and the lower bottom teeth. My body popped them off. I mean, it took a year or so, but yeah, like things shift, things move, and then they still shifted again. I'm still trying to decide what to do about this crossbite. So that's there. And then like from the mental standpoint, I would say like as a sophomore in college, I was diagnosed with ADHD, but honestly, man, I was just depressed. I was depressed. I couldn't get out of bed and not sleeping well. My parents had gotten a divorce at that time. There's a lot of things going on, and I didn't need a pill. I needed someone to teach me how to breathe. Actually, my whole life, I needed someone to teach me how to breathe well. So I had like these lots of sneaky little signs. And what's really fascinating to me, like, so even going further is I also love to smoke, and what I know now is like it's breath work with nicotine, but also it's wanting all these things like, to help ground me. Oh, and I used to bite my fingernails. I would bite my toenails until I got braces because I physically couldn't fit my toe in there. So if a kid is like biting their fingernails or their hair or clothing or pins,
Right.
or as an adult, if you feel like you always have to have a drink, or if you always have to be chewing gum, or if you smoke, or any of those things, like those are signs. So that rule number 2, your body is speaking really loud and clear to you. But it's like we need a translator. We need someone to understand like what all these things mean. And I would tell you probably the most frequent symptoms and complaints that I get from new clients or people that I'm treating older in age, usually it's TMJD, so temporomandibular joint dysfunction, like clicking, popping, pain, stuck, because we got this nice little tongue that fits in here. And you better believe if the tongue can't do its job properly, it's going to recruit other muscles. And that includes the way you open your jaw, the way that you speak, and also the way that your whole face is going to develop. So I like to say sometimes within the body, it's a family tree. Like sometimes it's your sibling, sometimes it's your parent, and sometimes it's like a second cousin once removed connection. Well, let me tell you, your tongue and your jaw highly correlated. Like they are right beside each other. So you better believe, like, if there's stuff in the jaw happening, I automatically want to look underneath your tongue. But it's snoring, TMJD, they don't want a CPAP, or they want to get off their CPAP, they're having migraines, or they're having like orthodontia relapse. They're having trouble nasal breathing. It's all of it. It's your tongue, and then it's your breathing pattern, and it's the habits that you've developed and need to unlearn and then retrain and then apply in all sorts of situations. And that's what I help with.
That's amazing. And it's so wide, it's so broad.
Yeah.
But like you said, it's a lot of us need a translator to be able to even know that we have dysfunction. Like a lot of those things, oh, it's just me, or that's normal, or it is what it is. You mentioned CPAP too, and like sleep apnea, and is that something people can get off of?
Yes.
When they know how to fix and work and do all these things?
So actually, I'm going to say yes with the caveats.
Sure.
Put an asterisk.
Yeah.
I always say, like, breathing is not going to fix everything. Like, run. If you go to someone that says, like, I can fix all your problems, run.
Yeah,
RUN, run. I am not claiming to fix all your things, but I want to help you understand what's happening in your body and then give you the tools to inform, empower, and support you. Ultimately, I don't want you to need me. Ultimately, I don't want you to need CPAP. But what I can tell you is we're going to do everything we need for your specific body, for your specific symptoms. And sometimes it's myofunctional therapy, tongue tie with a CPAP. So then you can actually get a good night's sleep. But what I can tell you, depending on where you are in like the degree of dysfunction or the degree of airway insufficiency, and also how dedicated you are. Like if you want to change, this is going to be a lifestyle change. This is not like I eat one salad and I'm healthy. No, this is like I need consistent change for probably 6 months. And then ultimately, this really just becomes the way that you breathe. So immediately it's like, let's try a Breathwork strip. And if that helps, you probably need to see an ENT. Let's also start seeing if we can retrain your tongue rest posture and see how that improves. Let's talk about your sleep hygiene. Let's talk about your nutrition. Let's talk about, are you in menopause? Let's talk about your hormonal changes. And the CPAP is really interesting because it is a big like blowhorn saying something is wrong. And sometimes we don't have the mental capacity to deal with it.
Sure.
And that's okay. But what I know is if you have the desire and if you're ready for some answers, that's a really great place to be. And I can tell you that I have had people that have significantly reduced their snoring, their sleep apnea. They've had amazing results, but it's the people that are dedicated and they're willing to try and they're willing to look at it from a multifaceted place, because it's not just me. It probably involves an ENT. It probably involves maybe a tongue tie release. It probably involves like some nutritional support. And then you better believe there needs to be some kind of like energy hygiene, sleep hygiene, something in that realm.
Right.
And then one quick note about women in perimenopause.
Yes.
Because this is Perrin's hot take on why perimenopause and menopausal women specifically are starting to develop sleep apnea. And what we know is you lose muscle mass through perimenopause and menopause.
Yep.
Well, there's muscles all in your throat.
Mm-hmm.
So if you do not have correct intraoral pressure from correct tongue rest posture, and you're not actively using these muscles, they lose their muscle mass. So then they become even more pliable, and you have this negative pressure pulling the air in. That's things close and collapse. And so I very much am using resistance training exercise to isolate just the tongue, just the jaw, just the lips, and then encourage and strengthen the diaphragm. So I very much am taking a resistance training approach to helping you breathe, but also to strengthen and tone and stabilize these muscles.
Right.
So understand, like, hormones in your sleep, big deal. I'm not that person to help with that.
Sure.
I am the person to help make sure that the structures are sound, that the habits are firm, and you have correct muscle tone as best we can with what you have and where you're starting, so that you have the best possible chance to get a good night's sleep.
Amazing.
Thanks.
Like, yeah, you're welcome, because it is. Well, and I think you bring up a great point when it comes to perimenopause and menopause. Like, we've done or been gone to plenty of events together on some of those things, and I think have a passion for helping people better understand.
Girl, it's because I'm in perimenopause.
Girl, yeah, you're living it, and I'm about to live a version of it at this postpartum. But from a perspective of the musculoskeletal, components of what you're doing, like you mentioned, it's a form of resistance training. When we think of resistance training as being a physical therapist, we think about like lifting weights, we think about like adding load, all that kind of stuff. Those muscles are so much smaller and so much more specific. It's not going to look the same.
No.
Right? So when you say resistance training, give us an example of kind of like resistance training for your tongue, like what that looks like.
So for example, I love tongue clicks.
Oh, nice.
And so we might start with like, just click your tongue however you can. And once we get there, now can you stabilize your jaw while you also click your tongue? So isolating just the tongue. It's going to feel different. Then once you're able to click your tongue, can you stabilize and seal the whole tongue up to your palate? And then can you open up your jaw and start to create more resistance where you have to keep your tongue fully sealed up to your palate? And then can you close your mouth and then open again? So that's like body resistance. You're using gravity and force to help with that. And then what we can do is like maybe put a mint on your tongue. Can you seal your tongue blade up to the palate with a mint in between and try to push it up, or use gum or
Love
any of that stuff?
It's like biofeedback, basically.
Yes.
Yeah.
Yes. And what's so cool is it's you versus you. It's you versus you. I want you to get the most gains that's possible for you based off where you started. And then as far as the jaw goes, like the tool that I love, it's called the Beckman Tri-Chew. Basically it looks like a dog chew toy, but essentially has different grades of resistance based on the thickness.
Right.
And I literally have clients chew on it 20 times each side, because spoiler alert, you're supposed to chew your food 20 times before you swallow it.
20 times.
20 times. And lots of us just rush through all that.
Right.
So really it's body resistance. And then what I love is it feels like lots of HIIT workouts. So I say these muscles will fatigue quickly, but they also recover quickly. And then fatigue in the mouth is really interesting. It usually, like for example, with the tongue, if I'm having them protruded out, that thing will start shaking, like fasciculations. I'm like, your tongue is about to tucker out. So let's take a break.
Yep.
Breathe. Then we like switch to some breathing practices.
Sure.
And then we come back to it. Then we take a break, breathe, and then we come back to it. So it's that high intensity interval training, taking breaks in between. Also lots of drooling that lets me know your mouth's fatiguing. Lots of times like lips and jaw muscles will start shaking.
Sure.
That lets me know that like stamina and strength and stability is what we're working towards. We're not there yet. We're working towards it, but it's lots of slow and steady steps with body resistance, sometimes with actual resistance, and lots of isometric movement. So moving one thing at a time. And a mirror is gold and really helpful for this. So you can get that visual feedback simultaneously as you're doing the exercise. Because lots of times, I remember when I was trying to do pointy tongue to spot, where you just stick your tongue out and then go back to your spot without moving any other muscles of your face. So literally I'm just protruding my tongue out.
Right.
my jaw would always lift up, and that happens a lot. So if you're not used to elevating your tongue or moving it independently, you're going to get other compensatory movements. So like supporting it with your finger or watching yourself so that you actually get the feedback of like, it is moving, it's not moving. What does it feel like? It's lots of little subtle shifts. So pointing tongue to spot to me is kind of like you're doing a plank and then you lift maybe your arm and your leg. Like, you know, opposite for like almost like a bird dog plank.
Right.
It's, to me, the blade of the tongue very much feels like the core of the body. And then getting into like what you do, like we got all these floors. So we got the tongue floor, we got the diaphragmatic floor, then we got the pelvic floor. And it's all these pressures and pumps, baby. Just all these different components. But I'm just shrinking it down to this specific area.
Absolutely. And I think as pelvic health therapists, physical therapists in general, we don't get a lot of training at all. I mean, and even you probably in speech-language pathology training, right? You don't get a lot of that in-depth training, right?
No.
So all of us in this field in pelvic health, we need specialized training to understand the intra-abdominal pressure system, be able, because you mentioned intraoral pressure, right?
Correct.
To be able to sustain and maintain function there, we need to understand intra-abdominal pressure as well for the pelvic floor to be able to function properly. And then the connection from, you know, the jaw, the tongue, all the way down to the pelvic floor. There's so many connections that people are unaware of until we start to dive into symptoms. Again, the signs that you mentioned, you know, people experiencing that it's this, your body is telling you something, but until you learn how to listen and read the language, it's going to be really hard to change.
It is. And I would say probably something that's taken me, so I'm 40, it's taken me like 40 years to realize it's like, be okay with not knowing the answer.
Yeah.
That's where the breathing and the mindfulness and the meditation has been invaluable. So there will always be something that feels like challenge and it feels like change. In fact, that's what life is, challenge and change.
Absolutely.
That's what our body is. That's what our world is.
Yeah.
I need you to be okay with not knowing the answer right now.
Yep.
But I need you to be able to breathe through it regardless. And that's how you're going to be okay as you're seeking the answers that you need.
Right. And you're going to find little ones along the way that that lead you to the bigger overarching answer for some of those pieces, which is a big deal. So when it comes to, you mentioned earlier when you're working with client and you made the comment of like, you know, oh man, this could take a couple years, right?
Yeah.
So like, could you give us a picture of, or maybe like expectation from a specific either diagnosis or something that you see, or kind of a treatment plan, maybe like 6 months to a year, or like someone that might need care for longer than that? Like, what are some of those specific things?
I'll tell you, like my run of the mill, what I get the most frequent is someone that at least is familiar with the tongue tie. Usually like they're like, my child had one. I'm like, great, either you or your spouse has one. So that's kind of interesting. Yeah. And like they're kind of aware of it. They're like aware of mouth breathing and they're like trying to, like, maybe they've heard of mouth tape or something like that. And what it starts off with is, I love a discovery call because I want them to choose me and I want to make sure that I feel confident helping them. So I always start with a discovery call because I want to make it a personal decision where you are invested in choosing it. And I want you to know that I feel confident that I can help you.
Right. Yeah.
From there, I go to an initial eval, and that's an hour and a half. And oh my God, it's so in depth. Sometimes I look at my evaluation reports, I'm like, this is so long. But
honestly, it's amazing. Well, you evaluated me before in the past, and just the thoroughness and all the things that you're assessing is, I mean, the way that you explain it very well. So thank you for doing that. Yeah, seriously, it's really, really amazing.
Thanks. Well, I'm doing a little bit of a speech assessment, swallowing assessment, an airway assessment, a mental health assessment, as far as like what's your perceived stress, what is that stress? Yep. I'm looking at your breathing and connecting your breathing rate to your perceived stress level.
I might have to have you come back and talk about that.
Oh, absolutely.
Because that stuff is
it's basically it's the closest we can get to a heart rate variability score without hooking yourself up to machines. Right. So I want you to have the tools to be able to get that biofeedback independently wherever you are. Yep. So the initial eval is like where basically I identify like, what is going on? What do I see? What do I suspect? Who else do we need? And then the way I lay it out is I need 4 sessions, minimum of 4 sessions about every 2 weeks. So It takes roughly 66 days to create a new habit. So between the initial eval and then 4 additional 50-minute treatment sessions every 2 weeks, I get that 66-day period.
Yeah.
And from there, you either are going to feel better, you are going to feel like you're in a stable place, or we're going to know what else is needed. And why I start there is because, one, I don't want to scare the crap out of like this client of like, you have this.
Right.
Also, it is completely overwhelming for them and for me. And what I mean by this, I'm like, well, one, you probably have a deviated septum. You probably have enlarged nasal turbinates. We probably have a tongue tie. You probably are going to need braces. Like, whoa. Right. This is stages. So we're starting with initial eval. Well, first off, discovery call, we choose. Yes. You choose, I choose. Great. Initial eval. We get long-term plans. We get the identification of goals. We break down what are those baby steps you're going to start doing right now.
Yep.
And then from those 4 sessions, it's going to help me know, like, what else does your body need? How quickly are we responding? What else is still present? And what's better?
Yeah.
And what I think is really cool is, like, I don't want to say, like, this is a life sentence that you're going to have to see me forever. I get exhausted. I get overwhelmed. So does the client.
Yep.
And really, this is ownership of your health. So let's say like we suspect a tongue tie. Usually I say, if I don't like know right away, or for example, if you're local to Greenville, I'll come to you for a travel fee, and I can tell pretty quickly by like elevating the tongue and manipulate it with my fingers and like really looking at it and measuring it. But let's say you're a virtual client or we're not really sure, like we'll reassess in those 4 sessions. And really it's, what do you notice? Like I identify a tongue tie now based off 3 criteria, which is form, function, and feeling. Form, what do you see? What do I see? Function, how are you swallowing? How are you speaking? How are you breathing? And then feeling. If I'm evaluating you in person, I want to feel like, do I actually feel the restriction when I'm doing a manual lift? Do you feel it when you're trying to elevate your tongue blade? And after those 4 sessions, you're going to know, like, God, my tongue is exhausted. Like, man, I really feel it right in the middle, or it is so tight down like my throat and my chest. Like, well, that's all connected to your tongue. And so after that 4th session, let's say you do want to move forward with the tongue tie. There's a great ENT that I love in this area, Dr. Sellner. I use him all the time.
Yeah.
There's also some really great dentists that use a CO2 laser. We find the best release provider for you, and then I'm going to want to see you 4 more sessions to make sure that we can get carryover, we can get aftercare, and you're healing properly, and then you know how to maintain. So usually, let's say like we suspect tongue tie, we think that's there, or sleep apnea and a CPAP. Discovery call, initial eval, 4 prior, 4 following, and then like more or less however you need it. And then I usually like to do like a 6-month follow-up, and then there's some that we're just breathing for mental health and trying to stay sane in 2025. And those I just see as they need me. And really I tell clients, like, I don't want you to need me forever. Like, some of the models of previous clinics that I've worked in, you sign up for your day of the week and your time, and you just go until they tell you you're done. And that is depressing.
Totally.
As depressing as
I agree.
it is disempowering, and it gives you no sense of momentum.
Or autonomy.
I was thinking of that too. Yeah. And also, it's also because it's just me, and this is what I can manage, and this feels good. And if I need to change it, we'll change it. If you need something different, we'll find something different. But that's been a pretty sweet spot for me, that I've had some really great results, and clients have been satisfied. And then I stay in touch. Like, I get them to come to like different events, like different breathwork events that I do in Greenville, or I offer some online courses that I've been working on. And I had like a great download earlier at this yin yoga retreat. I want to do this whole series called WTF, what the function.
Love that.
What the function
great.
tongue, what the function diaphragm. So I'm always like trying to think, how can I integrate this? Because not everyone has the luxury of being able to carve out time or the resources for individual care. And I think breathing better, breathing well is for everyone. And it doesn't have to be this a la carte service to get some benefit. So, I mean, bare minimum, go get a Breathwork strip. Bare minimum, start clicking your tongue. Bare minimum, can you find your spot, and can you check in throughout the day and like just ask, like, where's my tongue? Like hashtag where's my tongue is my favorite. I love
Hashtag
it.
Where is my tongue?
Where's your tongue? Yeah, where's your tongue? So it's like lots of little steps. And then when you're ready for more, do more. And I post so much on my Instagram about like education and what I'm going through and what I'm discovering and what I'm working on.
Yep.
And I just want to have lots of different touch points at lots of different price points and lots of different resources for a variety of people that are on all different starting points in their airway journey.
Amazing. So if people want to connect with you, get in touch with you, what is the best way for them to do that?
Well, if you want to follow me to see what my personality is, to see if we might be a good fit, follow me on Instagram at Breathe Well Be Well. And then my website's breathewellbewell.info. Yeah. And then from there, you can click book call and you'll be connected to my scheduler and just book a discovery call. That'd
Love
be great.
It. Perfect. Yay. I am so grateful that you were able to come and share about what you do and who you help and give us all the education. Because like I said, unless you have like that next level of integration, even after, again, our professional training, this is all post-professional training for you.
Yeah.
Right?
Well, I mean, what I will tell you is it's all post-professional training, and I made it through graduate school without knowing I had a tongue tie and had airway dysfunction. Like dysphagia class was really hard, and now I know why.
Now you know why. Yeah.
What I think is really helpful is the reason the discovery call, I want you to feel like you're choosing me, because I've had so many people tell me that they feel disempowered from the medical profession for their symptoms. And what I think is really powerful is they might be dysfunctional and not know it. So if you have a bad feeling about a medical provider you're with, I mean, they're people just like us.
Yep.
It took me years after being a speech pathologist and the daughter of a dentist to like figure this out in myself so that I could see what I didn't know before. And I always say, like, let's say you go to a dentist and you have a tongue tie concern and you feel dismissed. I always ask, or I always educate them, say, like, ask them, what's your personal connection to this? And that's why I feel so strongly about what I do, because of the personal connection, but also understanding, keep searching for the people that help you and you feel heard and you feel like are invested in your care.
Love it. I have one more question for you.
Yeah.
And as it relates to healthcare practitioners.
Okay.
So what advice would you offer to anyone in the healthcare fields interested in understanding and integrating more of some of that, like orofacial, myofunctional therapy, or not necessarily that, we're not going to be doing that, but like people who are open to, you know, being able to utilize more of those tools in their practice?
Great question. I honestly, I tell everyone to read Breath by James Nestor.
Yeah.
That was a huge catalyst of change in my professional career, because it was the first book that I felt like was putting into words the things that I'd been thinking about. And then, like, once you start reading Breath by James Nestor, there's like another book, Jaws, and there's another one called Tongue Tie by I think Dr. Baxter, which is a dentist, and it's a whole rabbit hole, but start with Breath by James Nestor. Awesome. I also like the Audible version. So if you're really busy, don't have time to read a book, his voice is actually not too bad to listen to.
Not too bad.
Yeah,
all right.
Not too bad. And really good information there. Start there.
Yeah, you definitely do that.
Yeah.
Well, Perrin, again, thank you for coming onto Limitless Live.
Thanks for having me.
Yes. And we need to do a deep dive into nervous system stuff with breath.
Gladly.
We could do another round here soon.
We'll do an actual breathwork practice.
There we go. Yeah, that'd be perfect. Thanks again. And until next time.
All right. Toodles.